patient increased the likelihood of an inpatient dying within 30 days of admission by 7%. This study was conducted on close to 500,000 patients across Europe, and the results closely mirror research findings in the USA, which served as a catalyst to improve staffing levels there. So with both the EU and the United States showing concern about patient safety, where does that place Ireland? A country which has always shown pride in its provision of first-class nursing care, a country whose nurses are headhunted around the world. Sadly, the reality at home does not reflect this. 900 nurses left the service last year, bringing the total gone since 2009 to over 5,000. Meanwhile, the public health service has never been as busy. Approximately 1.8 million citizens now hold medical cards, which is a record increase of 500,000 since 2011. Healthcare has now become a huge target for spending reductions, with little regard for things as positive patient outcomes or quality of service. The INMO found in a recent staffing survey that the maternity unit in Portlaoise was the poorest of all the 19 maternity units across the country, with midwife-to-birth ratios of 1 to 55. In fact, the news yesterday said 1 to 70. The recognised standard is 1 to 29.5. Nurses' workloads across the country are double and treble what is recommended to provide and maintain best practice. And we know all too well from the Winterbourne inquiry, the Francis report, the Keogh report, the Lees Cross inquiry, that the impact of poor staffing levels and inappropriate staffing skill mix impacts significantly on care failings. The ongoing moratorium on recruitment means nurses are now working under unsustainable pressure to deliver care to an ever-growing frailer, ageing population and an ever-growing public health population with complex needs and conditions. Roscommon has the highest population of older people in the country, and our hospital is now a level 2 facility. And as a result of cutbacks, many of the services have been reduced or discontinued, so people are suffering. Ensuring optimum staffing ratios in all healthcare settings is vital. We cannot continue to practice in unsafe clinical environments. As highlighted in the UK's Compassion in Practice document, the right staff with the right skills in the right place should be our vision too. This motion demands that the INMO, as a matter of urgency, engage with the Minister for Health, the HSE, patient safety groups, including HIQA, and all relevant stakeholders to work towards the introduction of minimum staffing levels. I ask you to support the motion.